Well, hello, it's Bruce Williams again, and today I want to present part 12 of my series on the selected gross pathology of the horse. And we're going to talk about some diseases that affect the urinary tract. Before we do that, as we always do, I want to thank my friends and colleagues who provided me these great images over the years, which allow me to put these lectures together. Let's start with a fantastic image from Paul Stromberg from the kidney of a foal, because I usually like to start with the diseases that affect the young animals first. The capsule from this right kidney has been removed, and you can see that there are multifocal areas of hemorrhage, and the surface is studded by the presence of numerous, variably sized, often coalescing abscesses. This is a great picture of a particular form of gram-negative sepsis, which usually affects foals within the first week of life. And this is, while it could be any gram-negative, and remember, little white dit dots throughout an organ all makes you want to think about gram-negative sepsis. And this is a great picture of Actinobacillus equili. These are usually umbilical infections. They can be acquired during parturition or even in utero. And they form septic thrombi, which tend to hit the kidney very specifically in the area of the glomeruli and some of the other vessels. You will see large bacterial colonies within the glomeruli and the vessels of the kidney. You'll also see them in other organs because it is gram-negative sepsis. You will see little white dit dots scattered through the liver and the spleen as well. On cut section, because Actinobacillus equili is most often caught and trapped by the glomeruli, it sets up a septic glomerulitis. And so the predominance of the abscessation in these kidneys is the result of glomerular trapping, and it's all seen in the cortex. Here are these areas of hemorrhage. These are areas of vasculitis. The septic emboli turn to septic thrombi. They block the vessels rupture. You have ischemic necrosis. You may have small infarcts as well. So it is a septic glomerulitis and vasculitis that's associated with Actinobacillus equili. Moving on to some other characteristic lesions of the kidney in the horse. Here's one that we saw a little while back, one of our other lectures, and I said we would come back to it. We saw it in the nervous system, said we would come back to it because the lesion in the kidney is very characteristic. Once again, we have the kidney. It's been bisected in sort of an odd pattern, and so it's been peeled. The poles have been peeled down, and you can see that there are coalescing areas of granulomatous inflammation and fibrosis. And this is that odd helminth parasite, Halla Cephalobus gingivalis. It's free living in nature. It lives in decaying plant matter. We don't really know how it gets into the horse. Is there a vector, or does the animal lay down in this plant matter and gets it in its skin? Not exactly sure, but it gets into a number of places in the animal, including the nasal cavity. It could get in through the prepuce or the genitalia, the vulva, and it generally travels in perivascular areas to some target organs. And in the horse, characteristic target organs are, of course, the gingiva, the brain, and the kidneys. And it's a very characteristic look. This is all fibrous connective tissue and granulomatous information. Very little other things look like this in the horse. I would certainly want to consider, when I look at this gross picture, because of the smooth nature on cut surface, I would consider lymphoma, maybe multicentric lymphoma. The other thing I'm going to consider in the kidneys of a horse, the kidneys of a cow, would be hairy vetch toxicity. A very interesting lesion, which is thought to be a type 4 hypersensitivity. Usually has a lot of granulomatous inflammation associated with it as well. So, great picture. Halla Cephalobus gingivalis in the kidney of a horse. Another lesion that is way too commonly seen in the kidneys of horse, and we've talked about this particular entity before in both segments of the GI tract, is papillary necrosis. This is usually the result in horses of abuse of non-steroidal anti-inflammatory drugs. There are a number of points in the horse's body in which the blood vessels require constant infusions of prostaglandins simply to remain open. And the renal papilla possesses some of the wimpiest blood vessels in the entire body. The vasa recta are affected by anything that affects the prostaglandin E2 and I2 that they need simply to stay open, or anything that increases pressure in the renal medulla. And so because nonsteroidals are potent COX-2 inhibitors, they will decrease the production of prostaglandins by interstitial cells in the renal medulla, and those vessels will absolutely slam shut. The renal pelvis will start to die backwards from its most distal point because of ischemia, and then you will get this greenish discoloration of necrotic tissue. If the animal survives, and chances are if you see this, you'll also see ulceration at numerous points in the GI tract. Also very commonly affected are the mouth, the stomach, the pylorus, and the right dorsal colon. But if the animal survives, then it can slough this tissue, leaving it still with a functional kidney, but a much widened renal pelvis. So nonsteroidals, we do see this type of toxicity in other animal species as well, but they are not as exquisitely sensitive, nor are nonsteroidals used as widely as they are in the horse. Phenylbutazone or butazolidine, or the older forms, tend to be much more toxic than the newer forms like Equiox and some of the later generation nonsteroidals, which are currently being used to manage chronic pain in horses. Here's an absolutely fantastic picture. Not a common entity, but a great picture from Paul Stromberg, and I always use this. This kidney is green. It is the kidney of a foal. Hey, we can see the capsule on this one. This wasn't peeled off, and there was no need, but you can see the entire cortex is a bright green. This is a condition which is known as cholemic nephrosis, also known as the hepatorenal syndrome. And in foals, if the body is flooded with unconjugated bilirubin, often as a result of autoimmune hemolytic anemia, where the liver is overwhelmed by the amount of bilirubin produced or presented to it for conjugation, or in cases where the liver is very immature or it is obstructed, the bile is obstructed, you can get tremendous amounts of unconjugated bilirubin in the system, and it is reabsorbed by proximal convoluted tubules. And when you get just a critical, really heavy amount, it imparts a greenish color. I got this picture many years ago from Paul Stromberg, long before Photoshop came along. So this is true color. The vast majority of cases never get this bright, but it's a very memorable picture and a great but rare entity, cholemic nephrosis. Polycystic kidney disease. It's very rare in foals. There was a case probably about 3 or 4 years ago on the Wednesday Slide Conference. It's only been documented a handful of times. It is probably a dominant form of disease or an autosomal dominant form of polycystic kidney disease because, as it is in the Persian cats, it's often seen in association with cysts in other parts of the body, including the bile duct and sometimes the pancreas. Animals with polycystic disease, or at least foals, generally die within the first few weeks of life, but sometimes you may see them. The dominant form of the disease presents the young animal with a functional kidney, which becomes progressively more fibrotic with more and larger cysts over time. But the recessive forms of polycystic kidney disease, generally the animals die very early or are stillborn, but the dominant forms, the kidneys are function but do degenerate. Defects in the genes the mutated genes that cause this have not been identified in foals yet, because it's not a common condition in foals at all. Here's a nice picture of a cross section of one of these kidneys, and you can see the numerous cysts within the cortex and some within the medulla as well. Another incidental finding that you can see in adult horses or foals, which usually is of no consequence, is the horseshoe kidney. Horseshoe kidneys are simply kidneys that are fused at one end, and in the vast majority of cases, horseshoe kidneys function normally. In people, it's considered a fairly common incidental finding, with 1 in 10,000 people having horseshoe kidneys, and the movie star Mel Gibson has a horseshoe kidney. That's a little bit of trivia for you. Now, this particular one didn't read the book, because you can see that there is significant hydronephrosis, some areas of very thin cortex, but a very wide pelvis. And sometimes they will fuse in the area of urine outflow and where the ureters attach. And if they do that, then you can have partial to complete obstruction. And that's what's probably happened in this particular case. This unfortunate animal had a common non-clinical finding, but just by bad luck ended up with a urinary tract obstruction. Here's a kidney that, or a ureter that has extensive hemorrhage and sloughing or necrosis of the transitional epithelium, which lines the ureter. Probably extends up into the pelvis. We've talked about this condition before. This is blister beetle toxicosis or cantharidin toxicosis. The female blister beetles have a sac of a very potent poison, and when these beetles are chewed or crushed by a hay crimper, it will puncture that sac. It will liberate this cantharidin, which is a toxin, and it's a very potent toxin which affects a number of organs. In the GI tract and the urinary tract, it causes necrosis of the mucosa and sloughing and incredible pain on urination for these animals, and it also causes myocardial necrosis. Cantharidin has been used in people for a number of topical medications, such as treating people with warts. It's absorbed by the lipid membrane of mucosal or epidermal cells, which result in the release of serine proteases, which break the peptide bonds in the proteins and cause disintegration of desmosomes. That's the mechanism of action and why you see widespread mucosal damage in animals with cantharidin toxicity. Well, we're running out of things to talk about in the bladder. In terms of tumors, the horses are not known for renal tumors. This is a renal adenoma. It's a tubular adenoma, and benign tumors are more common in our production animals, such as ruminants and horses, than malignant ones, and the opposite is the case in small animals, where we see a lot more malignancies than benign tumors. And these tumors generally arise from the epithelial cells of the proximal convoluted tubules, and they're incidental findings, rarely seen in old horses. Just a couple of quick diseases of the urinary bladder. We've mentioned before that parturition in the mare is a very fast and a very violent process. And one of the problems that may happen is that it happens very quickly. And if the foal is passing through the birth canal with a full bladder, it can rupture because of the tremendous pressure exerted in expelling the fetus by the uterine walls. And so when it ruptures, it's always in the same spot. It is always in the neck of the bladder on the dorsal side. And it tears right here. And the animal will develop a uroabdomen. Sometimes they're very small. This is a really nice one. And you can see the hemorrhage that suggests an antemortem injury. And so these animals, as I said before, develop a uroabdomen. You can tap the abdomen and you can get a very high creatinine ratio or creatinine value in the fluid that you get off. The animals themselves will be hyponatremic, hypochloremic, and hyperkalemic, as they resorb a lot of potassium that normally would be excreted in the urine. So bladder rupture in male foals. Okay, female foals, I suppose that maybe their bladder sort of gets expressed because the urethra is much wider during the process. But male foals, these are the ones, and I forgot to mention, that's very important. Male foals are the ones that get the bladder rupture. Okay, we're looking at the bladder of a adult horse. It could be a mare. It could occasionally be a stallion, and it is filled with calcium carbonate crystals. Now, a couple of things about horse urine. If you've ever seen a horse urinate, the last few pulses of a horse that urinates are generally very turbid or cloudy. This is not mineral. It's not like a rabbit, which normally secretes a lot of mineral in its urine. Most other animal species excrete calcium through the bile, believe it or not. Rabbits are the exception. So it's not this type of ureless sand. The normal urine in horses contains mucus, and the mucus is seen in the renal pelvis, and when it gets into the bladder, it sort of settles to the bottom. So as they empty their bladder, the last bit of urine that comes out is going to be cloudy, and that's very normal for a horse. This is not normal. This is a tremendous amount of calcium, and although calcium is normal in urine, this amount is way abnormal, and it is a condition which has a fabulous name and is known as sabulous, not fabulous, but sabulous cystitis. And it usually is the result of bladder atony from a number of causes, including Sarcocystis neurona, which we've talked about, a apicomplexan parasite of the spinal cord, Cauda-Equina syndrome, which we said might cause bladder or atony or anal hyporeflexia, and a couple of plant toxicities, including sorghum grass and Sudan grass, anything that will cause damage to the lumbar spinal cord or nerve roots. I learned this as a sequela of equine herpes virus type 4 infection in horses, and they would get bladder atony and ataxia. So I think those are a couple of good rule outs. So when you see this amount of mineral, you want to think, hey, there's something that has resulted in paralysis of the bladder. Well, I think we finally brought in one lecture in the horse at 20 minutes. So congratulations to us. I hope you've enjoyed this lecture on the gross pathology of the horse, and I hope you will come back often to the Foundation's YouTube channel for more lectures on the pathology of various species or organ systems. It looks like I have 2 more left. I will begin tomorrow with the gross pathology of the nervous system. Not the most exciting thing, because a lot of brain diseases look alike and have no clinical signs, but we want to do that one. And I still believe I need to put down some lectures on various exotic species. We've done the lab animals and the primates, but there are a lot of exotic pets, zoo animals, and wildlife that have not had a chance to collate. So I look forward to doing that by the end of the year, and I've promised, or the middle of 2020, and I've made a number of promises that once this gross pathology, all these lectures are in the bag, so to speak, we will start on some surgical pathology topics of interest. So with that, I wish you a wonderful day. I hope you are enjoying fantastic health. And as always, thanks for tuning in.